Так, ну что ж, уважаемые коллеги, сейчас ждем еще подключения Ярослава Лата. Dear colleagues, good morning. Now we are waiting. Yes, Yaroslav is here with us. Good morning. We are very glad to say hello you from our country, from Ukraine. We would like to say that our life changing 1 month and a half ago, but we are professional, we helping our patients, and today we will share our knowledges. So let us start. Our topic today will be about alopecia, about hair loss, and also, as you know, on 3-5 of April was Congress IMWC in Monaco, and in the end of presentation we will present some tips and tricks from our colleagues which were presented on IMWC. So let's start. How we work with our trichological patients. When it's just I have some problems, or I feel that I lose my hair, or that problem was and now it's begin again. So we start from clinical examination, from clinical anamnesis and trichoscopy. Clinical anamnesis. How long is this condition? What do you think? How much hair you lose? So how it starts? What do you think? What was the reason or etiology? So it was hormonal disbalance, it was stress, it was diet, it was treatment somewhere. Sometimes patients don't connect their hair loss with any condition. And we need after that to do some laboratory test. If it's a hormonal disbalance, if it's autoimmune disease, and also ask patient if she or he on a diet, and there is it should be some complementary amino acids suppliers, etc. Or something else. So we should know the reason why it's happening. After that, we do, of course, clinical examination ad oculi and also pull test from the different regions of the scalp and trichoscopy. About trichoscopy, we will talk today more precisely. So if we see that maybe it's hormonal disbalance, we prescribe male and female hormonal panel. If it's some supplements, it's iron or cuprum or something, or vitamin D, or so we also prescribe that laboratory tests. After we proceed to diagnosis, so what is it? And if we need another specialist, so it should be collegial treatment. If it's, for example, autoimmune disease or hypofunction of thyroid gland. So it's not only our treatment and not only trichoscopic treatment, because with thyroid gland, it's a symptom. Our treatment will be symptomatic, and we need to cure the main condition. So when we understand the reason and etiology and pathogenesis of hair loss, after we proceed to treatment protocol. And we will talk about trichological pathologies and how to prescribe treatment, especially in aesthetic medicine. And today we will talk about combined treatment and detailed injectable treatment. And we are very grateful to Helwal company, which is a Ukrainian company, And we also with Yaroslav will be very grateful if you will share this webinar by your social network, Instagram, Inaverina Clinic, and Dr. Yaroslav Lata in support of Ukrainian company Hialual, which donated a lot to our country, to our army. So thank you very much for that. So the trichoscopy. Trichoscopy, how we do it in our like a clinical basis, we see what's going on with scalp, what is going on with hair follicles, and is it loss of volume, do we see empty follicle, how many vellus hairs, what is going on with the scalp, is there is inflammatory reaction. And in that case, of course, we should reduce inflammation and only after that proceed to some injectable treatment, for example. So that's the treatment with combined treatment was for patient for 6 months before and after diffuse alopecia. So with trichoscopy, but not only, but also with micrography, it was much improved after our treatment. So in aesthetic medicine, our trichological patient, what conditions we meet and we treat as a dermatologist, as trichologists, dry and oily seborrhea. And in that case, we should understand what is seborrhea and is there some inflammation also, is there some seborrheic dermatitis, androgenic alopecia. So anamnesis, hormonal test, laboratory test, also telogen effluvium. It's multifactorial disease, and we should know the etiology to be right in our prescription and in our treatment. Deterioration of hair and scalp quality. That's also, we should know some etiology, pathogenesis, and should ask our patient how they for example, what is their home care for hair, scalp. Also, involuntary alopecia, alopecia areata, but it's totally dermatological. Pre-operation preparation, because if patient needs hair transplantation, we should also know how to prepare our patient to this condition, and also when to start rehabilitation procedure after hair transplantation, because this result will be greater with preparation and of course with our future procedure, how to maintain the result after operation. It's also very, very important. Mostly do that, of course, men, but sometimes women also. So how to do, and we will talk and give today your some protocols. So, Yaroslav.
Okay, do you hear me, Vlada?
Yes, yes.
Yes. Dear colleagues, I'm greeting you. Please write plus if you have a good sound and quality picture, okay? I want to understand this. Greeting, dear colleagues. I'm very glad to have you with us. I believe that the subject of our discussion today is interesting and relevant for your practice. Let's continue. I want to speak about seborrheic dermatitis. We know it's a chronic disease that has a characterized localization and clinical picture. Usually it is redness, itching, the formation of small scales. Also, we have cases when there is a rash on the skin surface, eyebrows, beards, and auricular zone. Rashes are often caused by the fungal malassezia. You must always remember with seborrheic dermatitis is the expression of inflammation inside the hair follicle and fat glands. Malassezia realized many toxins that support the inflammation. This leads to inflammation of the follicle and increase hair loss. The diagnosis is made on the basis of anamnesis and typical clinical picture. Please, Vladlena, the next slide. About treatment seborrheic dermatitis, usually the treatment is local, only local, but we recommended to use the steroids, short course, 1-2 weeks, and topical combination with topical antifungal drugs. More long time, 1-3 months. Sometimes we must combine systemic fluconazole of calcineurin inhibitors in severe cases. Today, we have good results from appointment of systemic isotretinoin in low doses for 3-6 months. Systemic retinoids help to reduce sebaceous glands activity. This removes the living environment of fungal infection, which leads to a decrease in inflammation. Combination of metronidazole gel 1% and azelaic acid 50-20% also gives a good result, nobler surface skin. But some injection methods are prescribed, nota bene, in remission and should reduce inflammation and seborrheic control effect. The next slide, Latlena. Oh, I see. Let's continue about telogen effluvium. Very often we notice telogen loss in our practice. Telogen hair loss, a pathology that is associated with the action of certain factors on the growth zone of the hair follicle. Here important that hair does not fall out immediately, but in 1-6 months after the action of a critical factor. Hair from the anagen stage passes to the telogen stage and falls out. We differentiate two conditions in telogenic hair loss. Up to 6 months is an acute hair loss. If the symptom persists and after 6 months, it's a chronic telogen hair hair loss. This can affect the choice of other treatment strategy. Let's continue. Next, yes. At the examination of the patient, we will see a decrease in the amount of hair loss of total hair volume. The patient will indicate that the hair remains on the comb in the bathroom after washing the head and on the pillow after sleep. Normally 5-10% trusted source of person's hair in the telogen phase at any one time. With telogen effluvium, the anagen phase slows down, meaning that fewer hairs enter the next stage. With this condition, around 30% of hair follicles move into the telogen phase, which means that higher shedding occurs. Oh yes, change slide. Thank you, Vlada. It is necessary to conduct a pool test. Pool test is important clinical mark for the doctor, which is considered positive when more than 10-20 hairs are pulled out. These hairs have a follicle but do not have gelatinous shell around it. Vladlena, please come back trichoscopy slide. Clinical, yes, thank you. At trichoscopy, we will see some typical marks. For example, empty hair follicles, prevalence of single units, perifollicular station, increased hair in the telogen, and growing hair. All of them indicate telogen loss. The main principle of treatment are to identify the possible cause on remove the effect of the factors on the human body. If a deficiency is found, adjust the diet or prescribe replacement therapy. If disease are detected, cure the main disease. Please, next slide. Oh, yes, yes. It's a really important topic. Sometimes telogen prolapse can be symptoms of androgenic alopecia. Trichoscopically, we will see yellow spots and the process of follicle miniaturization. What is the main difference between androgenic hair loss? In practice, this does not always correlate with the characteristic pattern of hair loss in hyperandrogenic alopecia. The next. Oh, okay, it's okay. We have two different clinical picture in women and men. There are women's pattern androgenic alopecia and men's. The clinical pictures is typical for women. Diffuse thinning of the parietal area while maintain the frontal hairline. And very important, do you know these symptoms? Christmas tree. This model including diffuse thinning of the central part of the scalp and relative preservation of the frontal hairline thinning with bitemporal displacement of the frontal hairline reminiscent of male pattern baldness. I present the diagnostics algorithm. Yes, thank you. Algorithm of laboratory diagnostics for women. It is necessary pass to blood test on the second, fourth, or fifth day of the menstrual cycle. It's really important. So we can identify the source of androgenic in blood. Next,
So now
yes,
it's
Vladlena, I give
my
you
turn,
words,
and
okay?
I would like to say that this is the most common case in that complains that our male patient come to our clinic. It's androgenic alopecia, and we also do clinical examination, but at the first we take anamnesis, we do trichoscopy, we explain patient that it's due to their hormonal status or their genetically predetermination. So the classification of Norwood Hamilton scale, we show our patient in which classification, in which stage our patient, and what result will be just, the prediction, which result can be after our treatment. Also, we should say that in that cases, our treatment should be not less than 3 months. And sometimes if it's from 5 till 6 stage, that sometimes it will not, our result will not be so, so prominent. And if patient has a high expectation, maybe it's better to talk about hair transplantation. And in that case, you will change your trichologic strategy and prepare to hair transplantation, and after treat and maintain this condition. The main reason of androgenic alopecia for men, it's and we should know it's in our strategy, that in that case we should use inhibitor of 5-alpha reductase, because testosterone became the dehydrotestosterone and cause all that changes that we can see in the clinical picture of our male patient. So the main pathogenic mechanism is androgen-dependent process. It's the action of 5-alpha reductase. It's also some aggravating factors. Can be also the irritants, pollution, etc. But the main, of course, it's the 5-alpha reductase. Also accumulation of free radicals, and that's why in our treatment we use some growth factors. We will use hyaluronic acid, succinate, we will use Perfoskin, and we will explain why we use that. Also microinflammation in hair follicles and fibrosis and disruption of microcirculation. So the therapeutic strategies, it can be, but very carefully, to prescribe the inhibitor of 5-alpha reductase, anti-androgen, but again, be very careful, and I would recommend also to be in contact with endocrinologist if you prescribe that. Hair growth stimulant, minoxidil. But in my practice, I prescribe minoxidil very, very rare, because we all know that after stop of the therapy, the situation sometimes come back. So, but that exists in our protocols. Metabolic complexes, it's amino acids, vitamin, trace elements, especially iron. Also in medotherapy, we also have cuprom tripeptide as inhibitor of 5-alpha reductase. PRP therapy, nano healing with growth factors, with stimulation, implantation of dermal papillary and dermal follicle cells, also it's available, and SVF fraction with mesenchymal stem cells. But it's not etiology. So in pathogenesis, how to improve, we know, but it's not the etiology. Yaroslav?
Yes. I want to speak about succinate. Okay. Depending on the stage of androgenic alopecia, we can combine traditional therapy with progressive injection methods. Today we can use succinate for treatment. Studies show that the hair follicle has a large concentration of receptors to succinate, and succinate triggers the cascade of regenerative process. So succinate depend receptors, which has a dominant role in hair follicle regeneration and clinical leads to improved hair growth and hair quality in various types of alopecia, including androgenic alopecia and telogen effluvium. The next slide, I want to show results. Clinical examination. Our Ukrainian colleagues, dear Professor Ovcharenko and Yulia Kachuk, made a clinical comeback, please. I'm explain. Vladlena? Yes, thank you.
Yes, I come back.
Так. Yulia Kachuk made clinical observation among women diagnosed with androgenic alopecia. We have two groups. The first group of 10 women were treated with minoxidil alone, and the other group of 10 women received combined succinic acid with hyaluronic acid, sometimes Electri, sometimes Perfoskin, healing. 6 times every 2 weeks, and plus minoxidil 2% in topical treatment. Evolution was conducted is 20 weeks after the end of the treatment. The method of fixation results trichogram, biopsies, and macro photography. The next slide, Vladlena. Yes, we see demonstrate results this clinical examination. There were more positive results in the examination experimental group who received to combined treatment. After the combined treatment, there was an increase in hair concentration, an increase in hair diameters, a decrease in the number of follicle miniaturization process, and decrease in hair in the telogen stage. Succinate triggers of cascade of progressive process through succinate-dependent receptors, which has a dominant role in hair follicle regeneration and clinical leads to improve hair growth and hair quality in various types of alopecia, include androgenic and telogen alopecia. Please next. Yes, I want to present some of the results are recorded on trichoscopy, where we see in an increase in hair diameters, an increase in the number of hairs in one unit, and positive results were recorded for patients with androgenic alopecia and telogenic hair loss. The next. Yes, download, okay. This trichoscopy, we can see the positive result. We have positive, we can see the positive change of hair diameters and number of hairs in the unit follicle. And I want show you next slide. It's a clinical picture. In this photo, you can see the increase of common hair volume and improvement its quality. The next, please. Yes, it's a really interesting case because you see area hair loss. It see decrease in the area of hair loss post treatment. in post-combinate treatment. Okay, then next, Vladlena, I pass the word to you.
Yeah, so what that treatment was about and what the product was used. Put plus, please, who work with this product, Electri. Just to know how deep we should stop on the product, because after that we will present some protocol of treatment with Electri and with Perfoskin. So please, colleagues, just put plus who already use this product. Great. So, what has been proven in the study and with which product? Electri is a product with hyaluronic acid 5.5 milligram per milliliter and succinate 16 milligram per milliliter in complex treatment of androgenic alopecia in women. So, yes, this. And why we talk about hyaluronic acid and succinate. Of course, we work as with needle, as with many needles with the Perfoskin. And in that case, we talk about growth factors and how our treatment will involve on that growth factors, our growth factors. Because we know that it needs to stimulate the growth factor, stimulate their vessels wall, so it's VGF. Also, its effect on proliferative effect on hair follicles. Also, its anti-apoptotic effect of connective tissue on papilla due to activation of anti-apoptotic regulators. Also, it's provide the interaction of connective tissue papilla with the follicular keratinocytes. So many aspects is involved in that process. And of course, it's a stimulation of the hair follicles. So what is really important to get the result and to maintain that result. And one of my favorite methods is Perfoskin, because in this method we combine action of hyaluronic acid, succinic acid, and growth factors, because it's a chemical and mechanical stimulation. So nano-healing is a powerful regeneration of the epidermis and papillary dermis due to the action of vital components. And of course, by that, expression of growth factors. So this is the synergy of regenerative process that we will use for not only for androgenic but also for telogen effluvium and all other conditions that we described today. So it's a nano perforation of the skin, and after putting their vital components such as hyaluronic acid by 5.5 milligram per milliliter plus succinate. And we know that succinate is one part of Krebs cycle. It's a great energetical potential for in all biochemical reactions. So the mechanism of nano-killing action in alopecia treatment. So why we use that? So growth factors, it's a regenerative effect, it's a differentiation and maturization of cells, improvement of graft enlargement, antiogenic action, and antifibrotic. And it's quite important in this condition. Also, succinic acid, it's a normalization of energy metabolism. It's anti-hypoxic because we understand that all need to make like a food and oxygen to hair follicles. Cytoprotective, anti-inflammatory, also regenerative. And about hyaluronic acid, we know a lot about hyaluronic acid. It's for restoration, for maintenance of water balance, for tissue mechanical support, etc., etc. So these two products
Okay.
we use in both conditions. Yaroslav?
Yes, yes. Do you hear me?
Yes, we hear you. Yes.
Okay, thank you. I see. Yes. In prevention and treatment, we can use two products. For example, Electri and nanohealing. They have a similar composition, but Electri is used in a papular technique, while nanohealing does stimulation through pronounced micro trauma. The next slide, please. Here we see a common protocol for treating patients with telogenic alopecia. Injection methods can be recommended for acute stage and chronic telogen hair loss. For example, acute loss. Injectable therapy. We use Electri every 2 weeks for 6 procedure. Or we can use Perfoskin complex once every 2 weeks for procedure, but the next procedure you must do until persistent redness of the scalp. And chronic loss after 6 months keep clinical marks. We can use Perfoskin one time every 2 weeks for procedure and similar until persistent redness of the scalp, and you combine this PRP therapy, the next step, PRP treatment, one time a month, 3 for procedure. And the next.
So the next will be a video demonstration how to perform the nano-healing treatment with patient. So we clean the skin and we pushing a little bit. At the first we are doing nano perforation and also pushing the plunger because inside of their device there is a syringe with hyaluronic acid and with succinate. So as you can see, here is the product, 5.5 milligram per milliliter hyaluronic acid non-cross-linked and succinate. And you see that it's still the drops of blood. Stimulation, so it's a mechanical and chemical stimulation. So we put in nanoperforation some product that need for to cure that condition. It's a telogenic effluvium or androgenic alopecia. So I will come back to presentation. So it's from the first, it was 33rd slide.
Yes, okay. It's a protocol.
Okay.
I would like to tell more about these treatment protocols for women with hyperandrogenic alopecia. On the background of other therapy, we can recommend the following the next combination: injection therapy to second stage stadium. Yes, We must use Electri every 2 weeks for procedure, or Perfoskin once every 2 weeks for procedure, but you remember, until persistent redness on the scalp. In the terminal stadia for 6ST, we can recommend it use Electri once procedure every 2 weeks for procedure, and Perfoskin complex nanohealing every 2 weeks for 6 procedure. But the next step, rejuvenation therapy, we use PRP therapy, one procedure, one course per year, but 1 month interval, 3-6 procedure, baldness and nappage technique. And other recommendation, 2 active course per year, 1 month interval, 3 procedure in similar technique. And I want to speak about another common protocols for men. We can recommend the following combination injection therapy. You see, it's really similar. We can use Perfoskin complex in one's second stage, and 34th stage combine Electri or Perfoskin complex, and the terminal stage 5-6 we must use Perfoskin only. But really interesting, this procedure, Electri or Perfoskin, it's good combined with PRP therapy in one procedure, and another, maybe another time. And it's preparation and maybe rehabilitation for hair transplantation. You see, we must use Electri in the pupil technique. In the terminal stage, rehabilitation, use Electri with PRP combination. The next slide.
And I would like to add here for, dear colleagues, can you just put plus who work in a clinic which has hair transplantation? Because we understand that it's a serious procedure, and in my practice, when my patient tell me that, okay, maybe I will go there, for preparation, I use PRP, at least 2 procedures with 3 weeks interval, and we stop it 1 month before transplantation, and it's here PRP 4 months after transplantation, but I use PRP 3 months after transplantation. Of course, we see for condition, etc., but it's 3-4 months after hair transplantation about PRP. About Electri, yes, it can be used even just to provide the good supply and metabolism, etc. So it can be used 1 month after transplantation. But the preparation, it can be also, for example, but you should stop preparation 1 month before the hair transplantation. So the next, Yaroslav, it's, yes, it's your patient.
Okay, thank you. Yes, thank you, Svetlana. It's really important information. I want to show you the good result. It's patient who take clinical examination. We see treatment protocol 5% minoxidil with combined nano healing Perfoskin device. It's we use six procedure. Uh, is its interval 2 weeks and combined PRP therapy. The next, please. In the picture, so we see a good result after 9 months in a women. The recommended protocol was used in the treatment minoxidil 2%. We use Electri 6 procedure interval 2 weeks. And next step is the nano-healing stimulation and PRP therapy 3 procedure. Next, please. We see patient with telogenic alopecia and good result after only Perfoskin complex. Only Perfoskin 6 procedure interval 21 days. And we use Perfoskin treatment with for patient with telogenic flavium, and you see protocol Perfoskin nanohealing for procedure, and after good result we got. It's my patient, the treatment protocol for telogenic alopecia. I'm using my clinic. I describe the complex with amino acid and vitamin B 3 months, and I use nicotinic acid in tablet 50 milligrams 1 time per day 2 months, but notably under control of blood pressure. It's peripheral vasodilatation. And the next step, I use 3 procedure nano healing 1 time in 21 days. And the next 3 procedure PRP therapy, but 1 time in 40 days. Thank you, Vlada. Next.
So one question, do you prescribe sometimes nano healing, for example, nano healing in 2 weeks PRP, again in 2 weeks nano healing, and in 2 weeks PRP, step by step, but not only one mono method, but also combining, not in one procedure, but like this protocol, or you prefer to stay like you described?
Thank you, Vlad. Yes, of course, we can combine another steps, but I'm like a little course nano healing and little course PRP therapy. But yes, it's maybe better we combine nano healing next PRP therapy and got better result, maybe. Thank you. The treatment protocol for androgenic alopecia in men, I only prescribe skincare shampoo for washing the head with sulfur 3 months. After every hair wash, use a topical corticosteroid lotion, betamethasone, the low dose. Do not rinse 1 month. And the next step, I use 1 procedure Regenera Activa autofollicular stem cells. And we can continuum, 3 procedure nano healing, 1 time in 21 days, and 4 procedure PRP therapy, 1 time in 4 days. Vlada, please next.
Да, so interesting
Yes, I
protocol,
see.
and with combination with vascular stromal fraction. So about corticosteroid, and here you have the same. So at the first, you prescribe shampoo and corticosteroid to like as anti-inflammatory treatment, and only after that you proceed to injectable treatment. Am I right?
Yes, yes, yes. Thank you. It's really.
Okay.
I see.
Thank you.
Okay, I can. Let's continue. Okay. The treatment protocol for androgenic alopecia in women. It's an interesting case because I'm use systemical therapy, reductase blocker, flutamide, 1 to 5 milligrams 2 times a day, 6 months, but only control of the dehydrotestosterone in blood. And similar shampoo with sulfur. It's skincare. After every hair wash, use it topical steroids lotion with betamethasone 1 month, and I can start aesthetic treatment. Use succinate in nano healing procedure 1 time in 4 days, and the next little course 4 PRP procedures 1 time in 21-28 days. But we got better result. We can see on this picture. After 9-10 months. The next.
So this is a question, very good question, and we will answer just in, just in 5 slides. The treatment with minoxidil and the recommendation from the Congress IMWC. Very good, very practical question, and we will of course discuss it, but a little bit later. It will be this protocol. So thank you for question. And now the treatment protocol of telogenic alopecia. The hair loss was started in 2 months after the operation with general anesthesia. So patient come and she tell that it's like all our patients tell that, when I wash my hair, I see how many hairs I lose. So after clinical examination, after that, she tell that it started after her operation under general anesthesia. We prescribe her the complex of amino acid and vitamins B group for 3 months, and we understand that the supplements our patient should take not less than 3 months, and nano healing procedures 1 time in 3 weeks, and it was 3 procedures. And we understand that it's not that reason, and the hair will grow in 3 months and she will see the result. But to maintain, to stop this situation and to stimulate the hair growth, we prescribe such a protocol. For treatment of androgenic alopecia, and you see on the trichoscopic picture that there was the inflammation and the work of sebaceous gland, etc. So we should regulate that. And in that case, we prescribe the shampoo with sulfur for 3 months as a symptomatical and pathogenical therapy. Also, after all his wash, day by, not each day, but day by day, he used the water solution of corticosteroid lotion for 1 month to reduce the inflammation, and only after that we prescribe nano healing procedures 1 times in 25 days, and it was also 3 procedures. And after, to maintain PRP procedures, you can prescribe it once in 2 or 3 weeks. It depends on the condition that was after nano healing and after using of sulfur, of as you can see on trichoscopic picture there. The stimulation of hair growth, etc., and the scalp is healthy. Also, some recommendation which was from Claude Chochard on IMWC, so they associated with hormonal treatment, that it can be also prescribed zinc, vitamin B2, hemp oil locally and internally. And he don't recommend and he don't use in his practice the progesterone and dutasteride. Locally, he use, as you ask, in that case, minoxidil 5% and also human growth factor. So 5%. And the supplements can be that we can prescribe in such a pathology. So, and for control of the hair loss and improve hair quality, it's of course iron, and that's why we start our presentation today from clinical examination and laboratory test. And if we see the free iron or ferritin, etc., low, we prescribe it. And it's mostly important also for women. And for women also, we should be in contact with gynecologist, endocrinologist, and see the progesterone, because it's also very important for progesterone if the iron level is low. Also zinc, which associated also with the white spotted nail, and also sometimes changing of smell and taste. So the clinical examination and anamnesis. So what was the question? Which kind of anesthesia is used in trichologic practice? And Yaroslav answered that only the medical sleeping, but it can be also general anesthesia, but only for hair transplantation. So it's very difficult to provide the anesthesia for hair treatment. And in general, 99% of our treatments is without any anesthesia. But sometimes we have some inhalators, inhalations for the maybe a little bit of sedation. But generally, actually, in my practice, I don't use anesthesia. So, and to continue, silicium and biotin and vitamin A. Also, some tips to know and some external treatment. It can be in lotion, combination of calcitrol and minoxidil 5%. And internally, it's a good combination to use, as Claude Chochard recommended, it's methionine, vitamin B5, amino acid, zinc, B6, and B12. So in this proportion. And so in conclusion, we understand that alopecia, it should be the combined, the treatment, it should be the combined therapy. When we made the right clinical examination, trichoscopy, laboratory test, we understand the etiology and pathogenesis, we prescribe right treatment. Sometimes in telogen effluvium, when we just take off the reason, the etiology, we can use monotherapy such as Electri or nano-healing, or if it's multifactorial etiology, we use combined treatment with external lotions and shampoo, with internal prescription, the supplements, and of course with our injectable treatment. And we recommend PRP and nano healing for growth factor and to make the synergy of our treatment also with hyaluronic acid and with succinate, because it gives us anti-inflammatory, antioxidant, antifibrotic, and regenerative effects on the scalp. And of course, it should be not less than 3 months. So we tell our patient that when you come to our clinic, the treatment will be 3 months, and explain why. So it's a multifactorial condition, and of course the treatment should be also combined. Yaroslav? So we can see you.
Thank you, Vladlena. It's a super conclusion. We understand that. I like that they demonstrated the high effectively and safety use combined protocols with Electri and nano healing. I want to thanks everyone and I want to thanks dear Vladlena for your support. It's a little bit hard for me, and I hope this knowledge, it's a new trend, if you can name it this, will help you patient, and I wish you successful practice. Thank you very much.
Thank you, dear colleagues, and see you on our next online trainings. We will be glad to answer your questions. Maybe you can send it to our manager or just in our chat, and we will answer it right now. So thank you very much, and good luck and peace to all your country, and of course to Ukraine. Thank you.
Yes. Thank you. Thank you. Have a nice day.
Thank you.
Bye.
Bye.